Acting Speaker. Acting Speaker, my grievance is to the Minister for Health. Minister, the McGowan Government was elected in 2017 with a clear platform. We were elected because WA jobs were our #1 priority. We wanted a health system that put patients first, and we wanted to prepare our kids for jobs of the future. Minister, my grievance concerns our efforts at innovation in the health sector. We know that to fix the significant debt and deficit legacy that was left to us by the profligate and financially negligent Liberal and National governments will take a long time. We know that to fix that legacy we need to diversify our economy. We know that we are world leaders in medical and health research and innovation. I think we can diversify and grow our economy by focusing our attention on these fields of endeavour. I wanted to start by touching on the nature of work. We know that automation and disruption are having a significant impact on traditional modes and methods of work. Dr. Frances Flanagan is a University of Sydney Fellow in the discipline of work and organisational studies. Her research concerns the crucial and changing role that work has played as a source of social cohesion, identity and belonging in the context of ongoing changes to employment relationships, technology and the environment. And I should also add that she's a friend of mine from when we studied at UWA together. In a 2017 essay entitled A Consensus for Care, she had this to say: how might our perception of the future of work change if we looked on it differently? Whether we recognise it or not, the job of maintaining the biological processes of the earth will be a major dimension of human activity in a low-carbon, highly automated world. This applies to the work of looking after human bodies as much as it does to the stewardship of ocean, sky and land. As we rethink and refashion our forms of agriculture, transport, mining, forestry, energy and chemical industries into low-carbon equivalents adequate to sustain life within planetary boundaries, labour will remain a constant. Aged and disability carers, early childhood educators and nurses, low-carbon occupations all, will endure through the thousands of micro-revolutions wrought by automation. No doubt many stealth-styled innovators will attempt to replace them with robots, tone deaf to how inextricable human relationships are in such jobs. All of us want to be seen and heard by another human being in moments of vulnerability that constitute the basis of these forms of work. No one wants to die in the company of a robot. In the absence of societal consensus, it can be easy to resort to despair in the face of an ailing system, but we're far from empty-handed. We can start with the givens, the timeless things that will inevitably be present in the future, rather than an overwhelming focus on what we are going to lack. We know that there will be children, that they will crave belonging, love and learning. Citizens of all ages will seek togetherness, connection to each other and to generations before and after. We will express ourselves through culture, endeavouring to make sense of our uniqueness as human beings and our shared cultural inheritance. Some of our bodies will work imperfectly from birth. Some will become diseased. All of them will get old. It can be distilled from what Dr. Flanagan says that jobs in our health and caring sectors will continue to grow. But I think we're on the cusp of an exciting time in what those jobs will look like. Whilst mundane and repetitive tasks will be amenable to automation, the more human aspects will only grow. Innovation in health will free up time and capacity for our caring professionals to focus with empathy and compassion on patients, not paperwork. Minister, Israel has been described as a startup nation. They are at the forefront of medical innovation and technological change. A unique constellation of circumstances has given rise to an ecosystem well-positioned and well-equipped to act as an incubator for this innovation and change. Outstanding research is coupled with an entrepreneurial spirit backed by a supportive government that plays an active role as a facilitator. I think there are a great many things that can be learned from the startup nation, which is why I was so pleased to join you on the Australia-Israel Chamber of Commerce delegation. Western Australia shares with Israel both an entrepreneurial spirit and a tradition of outstanding medical innovation. The calibre of delegates on the trip was a testament to both of these attributes. For me, it was an honour to travel with, learn from and exchange ideas with people like WA Chief Scientist Peter Clinken, former WA Chief Scientist and current Chair of the Board of the Royal Perth Hospital Medical Research Foundation, Lynn Beasley, the CEO of the RPH MRF, Jocelyn Young, another colleague from UWA, Michael Winlow, who is now CEO of Linear Clinical Research, Professor Kevin Flegger, the Director of Life Sciences Hub at UWA, Rebecca Tompkinson from the Royal Flying Doctor Service, Associate Professor Paul Bailey from St John's Ambulance, who's also from the Emergency Department at St John of God, Murdoch, and numerous other academics and industry representatives too many to name. For me, it was an illuminating experience to travel to Haifa, Tel Aviv and Jerusalem to visit venues such as Razor Labs, the Rambam Health Campus, the Technion, Diagnostic Robotics, Zebra Medical Vision and the ARC Innovation Centre at the Sheba Medical Centre. For me, it was a great privilege to hear from experts like Dovi Marcel, VP at Operations of United Hutzler in Jerusalem, Dr. Kira Rudinsky from Diagnostic Robotics and Michael Zolotov, the CTO of Razor Labs, and Elon Ben David, a senior journalist and defence correspondent. As I mentioned in my members...
Member for Dawesville, I called you order for the first time.
As I mentioned in my members' statement last week, I am deeply grateful to Mark Maisner, the Delegation Director, Paul Israel, the Executive Director of the Israel-Australia Chamber of Commerce, and John Kluwer, the CEO of the Australia-Israel Chamber of Commerce. Minister, I also look forward to your report on this delegation and what you gained from this incredible experience. Minister, I genuinely believe that as a government, WA jobs need to be our #1 priority. To drive growth in jobs, we need to diversify our economy. I genuinely believe we must have a world-class health system that puts patients first. But to ensure that we're able to maintain that, we have to be at the cutting edge of innovation. I ardently hope, as a father of 2 young children, that we can continue to prepare our kids for the jobs of the future. And in the wise words of Dr. Flanagan, the job of maintaining the biological processes of the earth will be a major dimension of human activity in a low-carbon, highly automated world. Minister, my grievance to you is this. When it comes to 21st century medical innovation, what can the McGowan Government do to meet these 3 vital goals of diversifying our economy to ensure WA jobs remain our #1 priority? What can we do to ensure that we maintain a world-class health system that puts patients first? And what can we do to prepare our kids for the jobs of the future?
Minister for Health, hard act to follow.
Thank you, Acting Speaker. That was an extraordinary summation of the trip, Member for Mount Lawley, and so I really appreciate the opportunity for your grievance, to respond to your grievance this morning. And I will in due course be, of course, providing a formal report to the Parliament on the recent delegations that I led to both Israel and to Philadelphia at the Bio Conference. But Madam Acting Speaker, just last month, the Premier and I were at the Harry Perkins Institute launching, as a result of one of our budget announcements, our intention around the Future Health Research and Innovation Fund to create a sovereign wealth fund that will fund medical research and innovation into the future. And I made the observation at that time, Madam Acting Speaker, that we were standing as we were in that precinct at Harry Perkins, which of course includes Linear, and across the road, the Telethon Kids Institute. We were standing in a precinct which had generated over 1,000 jobs. And I need to impress upon both the Parliament and the Government the importance that biotechnology and medical research and innovation plays as part of our diversification of the economy package. Hopefully I don't have to take all of you to places like Israel to convince you of that, but it's very pleasing to see that you've definitely heard that message loud and clear, Member for Mount Lawley. And on that point, can I just thank you for the information you've provided from one of the recent Bankwest Curtin Economics Centre's Focus on Industry series, the one held in December on health and happiness, which really does nail the issues around just what an important job creator medical research and innovation is. And our intention around the Future Health Research and Innovation Fund is to do essentially 4 things. One is to improve healthcare. That's obviously front and centre of everything I do as the Health Minister in the McGowan Government, to put patients first. But we also believe that it's important that if we create a vibrant research and innovation ecosystem in Western Australia, we'll attract the best and brightest clinicians, researchers and innovators, which will ultimately go to continue to improve our overall health system. But we can diversify the economy, getting away from a dig it and grow it a mentality which often afflicts a lot of our thinking here. And I want to acknowledge the Minister for Tourism and the work that he's doing. It's part of that diversification package we heard from him earlier. But also, of course, to create jobs. which is the central tenet of us as a government, and to make sure that everyone shares in the prosperity of Western Australia, and making sure that we share that prosperity right across the community by creating good jobs. And in health and biotech, there is good quality jobs to be had, long-term jobs which can really generate great wealth and well-being. And so, Madam Acting Speaker, I took a delegation of around about 40 members from the universities, the health sector. I think you've named a number of them there, member, from the health hospital sector as well, to really understand what we could learn from Israel as the startup nation and the approach that they take to medical research and innovation. It's an extraordinary community. And it's one that I understand the member for Mount Lawley has a close association with, working so well with the Jewish community in his electorate as he does. And it was terrific to be accompanied by Professor Peter Klinken, the current Chief Scientist, former Chief Scientist, Professor Lynn Beasley, but also the Director General of Health, Dr. David Russell-Weiss, and a range of health leaders to look at what we can learn about building innovation in our sector. Israel, is struck by a range of constant existential crises born from their geopolitical situation. And while we are nothing on the same scale, we share a number of characteristics in that. And Israel says we have no friends. We have no friends either. Canberra won't save us. Melbourne won't save us. Sydney won't. No, that's right, it's not. It's not. But we are isolated in the same way that they are politically isolated. And we have to actually stand on our own 2 feet and work with the Southeast Asian and Indian Ocean economies to make sure that we are an outward-looking economy that really works closely with with that region to improve our economy and our community. So it's terrific to see the way the Israelis have this drive around improving innovation, making sure that that health and health innovation and the provision of it is front and centre of everything they do. And we learnt from innovators there that failed once, twice. One chap who had recently just sold his health innovation company to the US for something like $100 million said that it was his 7th attempt. And the first 6 attempts at a startup failed. Yet he was supported at every step along the way to make sure that, that he could get his ideas up, generate those, build those ideas, and ultimately come up with a hugely successful exercise. Now, our ecosystem is different from the Israelis. We don't have a venture capital system like theirs, which really brings a lot of cash to that early discovery regime. We don't have the Israeli military, which actually provides an incredible university around technology and innovation in terms of the way they defend their country. We don't have the same resources as the Israeli national government in terms of pump priming their innovation industry. But we do have things that we can learn from that. That is a can-do attitude, which is part of what we do in Western Australia in driving our health system across 2.5 million square kilometres, the most isolated and health single authority health jurisdiction in the world. So what we do has to be different, and we could really learn from the Israelis in terms of how we can go forward and make sure that we innovate and create jobs for the future.